everyone. Welcome again to Leaders Uncut. Thank you for joining us here today. Today, I'm really pleased to have with us somebody very special who is doing something so important, and his name is Dr. Tony Okafor, and he's the founder and CEO of Solim Health. Hello, Dr. Tony. I love to call you Dr. Tony. I know it sounds great.
Hello, Catherine.
How are you doing?
Hi. You're bringing back memories of when I was actually in the clinic and seeing patients and everything. Dr. Tony. Most people just call me Tony now.
I call you Tony. Okay, I'll tell you Tony. That's fine. I can do that. Okay, great. So I am looking forward to, first of all, giving us a little bit of a background on yourself, and then talk to us about the reason why you started Solim Health, which is really a company that is offering research-backed, certified dementia, practitioner-led virtual therapy, really, and it helps people with memory loss. And my God, so many people now are experiencing this type of challenge. So I'm going to hand it over to you, give us a little bit of a background, and talk to us about the reason why you launched Solim Health.
Yeah, so I probably best if I start a bit about myself and then go into that transition. So like you said, I'm a medical doctor in London. Initially going into medicine, I wanted to do surgery. I read Ben Carson's books and I was like all about the gifted hands. But then I saw one of my senior registrar who was an ortho surgeon actually. He got on a table to do a knee replacement and pulled out a rope and a hammer to attach the two parts of the knee. And I was like, I don't think surgery is for me. There's not there's some innovation happening, but it forced me towards the whole, startup world. So I launched my first startup when I was in med school, and we were digitizing the ambulance process. So the technicians can see what's going on the ground and guide people in that. So that's my entry towards it.
Okay.
But because of that, I sort of realized, I needed to learn a bit more about business. So when I graduated from med school, I had an offer from the, prestigious McKinsey and Company I was excited about. But I decided to work as a doctor for at least a little bit because of, to make my parents at least happy that I didn't just go to med school and not practice. But then when I went to McKinsey, I got a lot of experience. I really loved it. We got to work on some very important stuff. But in that time of med school, I worked in care homes. I did part-time work in care homes. During my time as a doctor, I worked in elderly care. So we saw a lot of patients with dementia. We, prescribed drugs for them. We saw their families and all the difficulties they were going through. But it wasn't until my time in McKinsey that I had a personal family member that got dementia themselves. And I quickly saw how quickly they forgot, who it is that they were surrounded by, their loved ones, some of the things that made them special. And it was quite a difficult thing to see. And, it's easy to detach yourself when you're a doctor from, the patient's experience a little bit but when you are actually on the other end, you really see the real pain points. So we started looking into, what are the things that are available for people with dementia. And most of the drugs in the dementia space are tailored towards the later stage of dementia, when you've already forgotten a lot about who you are, a lot about your loved ones. And from my experience, and I imagine most of the listeners are probably in a similar sort of perspective, it's a bit late to really try and help in the later stage. And the reason for that is because a lot of these drugs do have some risks associated with them. There is the risk of swelling of the brain or some slight bleeding, and because of that, you don't tend to give it in the earlier phase where the risk does outweigh the benefits. So there is a massive gap between when someone gets diagnosed and when they become super bad, and we're trying to fill in that gap of providing solutions that have been shown to improve cognition and memory recall, and we're using technology to do that.
Okay, well, that's fascinating. First of all, thank you for doing this, because like I said before, it's such a critical area where people need a lot of help, and it's destroying families, right? When you are going through something like that, I mean, it's traumatizing.
Yeah, I mean, it's on par with something like a cancer, because it is such a massive impact on your life and the people around you. And your wife becomes a caregiver, your son and daughter becomes a caregiver. and nothing can really prepare you for that.
No, no, for sure, nothing can. So, can you explain, in layman terms, because I know you're a doctor, but explaining really what it is, how does it work to reconstruct someone's memory, and how your platform approaches dementia, and how it is different from existing therapies and existing solutions out there.
Yeah, so I think that it's probably better if I explain what it is my platform does.
Yeah.
So there's three ways in which we are approaching dementia and memory loss. The first way is the one that's super backed by research, and it's a therapy called reminiscence therapy. And essentially, what we allow is we have dementia practitioners on the team that can jump on a telehealth call with, customers or patients anywhere around the world. And what they do is this reminiscence therapy, and it's backed by tons of research. It's had thousands of participants. It's really popular in Europe and less popular in the States for some reason. But essentially, what they do is they identify core memories that are important to the actual identity of the person and strengthen those memories to with the intention of protecting against the dementia decay.
Mm.
And in practice, what that looks like is, you know, if we see our brains as like a memory card, it means that as dementia deletes things to preserve space, we ensure it's not deleting the things that matter most to that person. So if it deletes things about your, day to day at work and that was super boring and mundane, fine. But if it deletes you remembering your wife's name and that honeymoon you guys had, I think that's a bit more of a bigger problem. I think
Mm.
that's the easiest way to put it. And these dementia practitioners are skilled to, allow you to really explore those memories and then reinforce it. And something happens in the brain. It's a compensatory mechanism. When you revisit those memories often, the brain starts to, build those nerve pathways and strengthen them so that those are sort of protected against the decay. And that's what we try. We're had. I think that's a bit more of a bigger problem. I think
Mm.
that's the easiest way to put it. And these dementia practitioners are skilled to, allow you to really explore those memories and then reinforce it. And something happens in the brain. It's a compensatory mechanism. When you revisit those memories often, the brain starts to, build those nerve pathways and strengthen them so that those are sort of protected against the decay. And that's what we try. We're focused on doing so that those are like the last memories to sort of go. And
Mm.
all the memories we rebuild. It's all recorded so families can revisit these recordings of your loved ones talk about memory, and then we rebuild that using AI, those images and those scenes, and then it's all stored on the platform. So even if someone does start to decline, they have it all there somewhere, stored, ready to go.
Okay, I mean, you just mentioned something. I was going to ask you the questions because AI is a component of what you're doing, obviously. And
Yes.
has that been a total game changer for you? Because I'm sure you've been thinking about doing this for a few years, and now AI comes into the picture, and what you're doing. And I mean, it's deeply complex. It involves neurology, psychology, social factors, right?
And
So
AI.
and AI now, right? I mean, it's
Yes.
what a mix. I mean, can you talk about this? Because I think this is really fascinating.
Yeah, so I mean, what we're essentially building is the ability to recreate any memory. So anything you can think of right now, Catherine, we can rebuild it to the fact where it looks like you just recorded it on your iPhone. It's hyper realistic.
Wow.
Um, and, you know, for people who have memory loss, the ability to rebuild those memories could mean the difference between them actually remembering or not. So we're allowing people, we're so grateful that AI is where it is, and we have our ways in which we're able to rebuild this super well. So we're super excited about that capability. In
Mm-hmm.
fact, we launched 2 weeks ago, and what we've seen we had like 1,200 signups in the first week, hundreds of bookings. And what we've seen is a lot of patients, a lot of family members are saying, hey, we don't necessarily have all the free time to book in this session. Is there a way in which you can make it available for us to, do this with our loved ones directly and rebuild the memories? So we are working towards potential like releasing that pretty soon.
Okay.
That allows, you to just go in and build a memory of you and someone that's close to you without having that technical expertise. It is a difficult challenge, but we are going to roll out like the version 1 or 2 of that.
Okay, so wonderful. So you also had some free pilots. You were working with about 100 people. I mean, is that over now, or is it still going?
We did that months ago, and the
Okay.
purpose of that was to really understand like what is important in the telehealth process. Because there's already tons of research and data on like how to do these sessions well, but we were more sort of seeing what are people's response to the AI that we built.
Mm-hmm.
And we found that it wasn't necessarily about the realism. It was more about making sure that it reflected real life. So,
Mm.
um, one of the things that we took out of that is that we ensure, I'm not sure how much I can talk about this, but
Yeah.
we we make sure that the location where the memory happened is actually real, and that yielded a lot of what's it called? It yielded a lot of like improvements in people's ability to remember the memory better. So when you
Mm.
actually immerse them in the environment, not with VR, but just when you put them in the actual environment, there's thousands more triggers than if if the memory was in a lake with a mountain and we just created a lake and a mountain, it might not necessarily trigger anything. But if we actually bring back the actual lake and mountain where it happened, then a lot more triggers are happening because that person was actually there and they probably remembered something that was going on in that
Mm.
moment. And the brain is triggered a lot more and you're able to then access lots more from that memory. So we learned quite a bit from that. We also learned that VR and AI is probably not the way to do it because, it causes a lot more confusion than it does
Mm.
provide benefits.
Yeah. Yeah.
So
I
yeah,
can
we
see
learned quite
that.
a bit from that.
Yeah, I mean, I can see that. So, yeah, so the dementia care market is expanding globally as populations are aging. I mean, it's right. We are becoming older and older. So, what segment or geography is Solim Health focusing on first, and why?
Yeah, so I mean, dementia. I mean, we have an aging population,
Yeah.
and people are having less kids.
Yep.
So the percentage of the population that is older is only going to grow. So it is. I mean, right now in the United States, which is our primary geography, they spend almost half a trillion on just dementia-related services.
Wow.
Um, and that's not accounting for the older people that don't have dementia. So, the aging population is ever rising. I mean, it's like a 1 in 11 chance if you're over 60 of having dementia. But by the time you get to over 80, it's around like 1 in 3, which is,
Wow. Over
you
81 and
know,
3, so it shifts dramatically in 20 years.
there's
Wow.
a direct correlation between dementia and age. It's not a normal process of aging, but then again, living
Wow.
to 80 and 90 is a miracle in itself. So there is some setbacks to that. I mean, most of your bodily organs and joints are failing, so the brain is really no exception there.
Wow, that's fascinating. Yeah. So for local businesses and small businesses, partnerships and scaling, it's really key. So how are you building relationships? Because I think that that's probably a very important part of your business, those relationships that you're building with care institutions and healthcare providers and insurers and other stakeholders, because all of those will for sure amplify Salim's reach, right?
I 100% agree. So we are creating capabilities that allow our services to just, neatly integrate into residential homes
Yeah.
where a lot of our patients will be. That can neatly be integrated into palliative care, into people who's had grief-related depression. We also are the telehealth service is actually Medicare reimbursable, so we are sort of putting together the capabilities for us to actually provide this to Medicare patients. It's not yet available, but we're putting that together.
Okay.
And I think the most important things about these institutions is that they've already built trust with our future customers. And if we can show them that we are, a agency that they can work with, they can trust, it means that we can sort of bypass or sort of leverage that existing trust that those institutions have and not necessarily have to build it from the ground up because, trust is a very important factor in all of this. And
Oh, yeah.
obviously, once we've established that trust, working, tooth and nail to ensure that we maintain it and our reputation, in this space is very untainted.
Yeah, for sure, for sure. Yeah, I mean, everything you do right now as a startup, launching a company, has to be measured, right? Because
Yes,
you have to provide data to build that trust, and you have to provide consistent data. And
exactly.
impact is often measured in both clinical outcomes and business metrics. So,
Yes.
your KPIs, key performance indicators that you are consistently monitoring at Solim Health? I mean, it could be improvements in cognitive scores, patient engagement, cost savings, retention. So, what is it that you focus on, and that you think you can leverage the most to generate more of that trust that is critical?
So I think when it comes to the telehealth services, the health services, a lot of the KPIs will be factored around the engagement between our practitioners and our patients because, the practitioners are representing us in every single session they do. And we recognize that the population in which we are dealing with, I've worked with this population massively throughout my career, is a very vulnerable one. And not vulnerable in the sense that they're incapable, but vulnerable in the sense that they are, experiencing a very life-changing, and they're going through a very life-changing experience. And they are more emotionally volatile, they are more
Mm,
emotional and sensitive to like our responses. So making sure that our team is very well trained. There's a lot of feedback scores that come back from
yeah.
our patients to, give insight on our practitioners. They can rate the practitioner out of five. There's a lot of MPSs, like how likely are you to refer to services or refer that specific person. But we also use AI in another interesting way where all of these sessions are recorded. Of course, we get consent and everything, all the data belongs to the patient, but we are able to see what is working within the session through the transcriptions, through the reactions people are having, and we're ever changing the structure of our, clinical approach to sort of match what works best, whether it's,
Mhm.
happy memories, whether it's fun memories, whether it's wholesome memories, whether it's even some sad memories, because sad memories also are part of the building blocks of who we are. So, ever walking that line and making sure that we are ensuring quality, but also being, sensitive and intentional as well.
Yeah, I mean, you have, I think, a major advantage here as a business owner. You have that medical background, but you also have some experience that it probably gave you some great insight on business with McKinsey, right? I mean, that is critical. But as a business owner, to have that insight too, which is, I'm sure, it's making a big difference for you, isn't it?
Yeah, I mean, massively. I mean, the
Yeah,
difference between my first ever startup versus this one is night and day. And
yeah.
I went to McKinsey intentionally and I said, hey, I'm going to be at McKinsey for 2 to 3 years and build a startup because McKinsey it was an excellent place to really hone your business knowledge,
Yeah.
learn about the financial institutions, learn how to navigate that. And I think sometimes the reason healthcare is being left behind in terms of, positive innovation is because a lot of the people that come in to innovate do not have a health background and they might not, know how to really handle patients because that required a lot of training for us to handle and
Yeah.
to gather.
Yeah.
So if you compare that clinical background, that insight, and the emotional intelligence with business acumen,
Yeah.
you can build a real business that people can trust.
And it's critical. Those qualities are critical. In addition to all of those, I would add speed. You have to be fast on your feet right now. You just
Yes.
don't have time to wait forever, because the world is changing. AI is has speeding up, it's been speeding up everything. So that too, you have to be fast on your feet, and you have to make decisions also very quickly. Have you noticed that? I
Yeah.
mean, that's something that you experience every day too.
Yeah, I mean, I had to make a recent decision to so this ability to give our customers the ability to rebuild memories themselves. They'll speak to one of our voice agents. um, it is a wellness tool, and it is based off that reminiscence therapy, but we can't make any promises in terms of outcomes. It is just simply a wellness tool, but the decision to allow patients to speak to this agent and to provide it with data, and then that data will be sent to us and allow
Yeah,
us to rebuild
yeah,
that memory. That was a decision based off the speed in which the market is moving,
yeah,
and also based off feedback from our customers saying, hey, we want to be able to build the memories. And we don't necessarily want to always have to schedule and speak to someone to do that. Sometimes we just want to do it directly with our loved ones. Um,
mm,
so that was also prompted by,
mm,
the speed in which AI is moving. But
mm.
the speed of AI benefits us massively because, we have a plethora of closed source, open source models that we leverage, and that we have an entire agentic flow, which allows us to rebuild these memories super well, super accurately, and very impressively. So
Mm.
um, the developments in AI benefit us massively. Some of these companies are making it easier for us to do our job.
Yeah.
If you go back before ChatGPT, what it required to build what it is that we were doing, would have required either like a gaming studio type of approach or a film studio approach, which would have cost us millions,
I know.
um, or even just like tens of thousands just to build one memory. But now we can build it in less than an hour.
Isn't that crazy? I mean, that has changed so many things for everyone. So, I mean, that's really, I love to hear that positive insight on AI, because you hear so much negativity about it, but it really has been game changer. It's giving a lot of freedom for owners, for innovators to create something fast. And we need this right now. I mean, what you're doing is life changing. It's going to be critical for so many people all over the world. So that's a good
I
segue.
agree.
Yeah, that's a
I
good segue
think
to no. Go ahead. Go ahead.
Oh, sorry. Yeah, I think this whole discussion around AGI has really, you know, I think it's messed up the perspective on artificial intelligence because, if we actually just sit back and reflect on what AI is capable of right now, we would be marveled as like what it would unlock. If we were able to just pause AI development for like half a second and just think, hey, what have we actually built so far? There's a lot of value there
Yeah,
that we are not even looking at because we're so focused on this race to AGI rather than the journey there and what we can produce along the way.
very true. Very true. So, where do you see Solim Health in the next 5 years? I mean, what does full scale look like? Technology adoption, geographic footprint, product portfolio. There's a lot going on. So, where do you see your company going?
I mean, I can't, provide too much of that detail, but right now our clinical services is available in 44 states, out of 50. We envision that will be the first line treatment of dementia. So, like, once you get a diagnosis, we envision that, because of the cost effectiveness and also because of the low risk and, the clinical benefits, we would be what neurologists would recommend first line. And we would be available on Medicare for everyone who's over 65 to be able to use. So, we would save people money, save the government money, and also, have a very positive impact.
Mm-hmm.
There's 7 million people with dementia. Unfortunately, we can't target them all. We can probably reach around, 5 million that have moderate dementia or less, and then the 15 million people with mild cognitive impairments. So we envision that, we will be used clinically for 2 million people with dementia, and we would be used in a non-clinical settings, to build over 100 million memories, and it will all be stored in our platform. And if people do decline, if people pass away, they leave behind a legacy that their family can at least, reflect on. And
This
it's
is
not. it's not we chose this path for a reason because we don't want to, dilute the impact of someone's legacy. We want them to be the author of it's themselves.
Yeah, this is a beautiful thing. I mean, it warms my heart to see solutions like that, come into the picture and available to everyone. I mean, that's beautiful.
Yeah, I mean, back in the day, I mean, something like this would only be available to the billionaire class, but
Yes,
we're bringing it
yes,
to everyday people.
I know.
Um,
And that's what we need. I mean, the healthcare system in this country needs help. I mean, if we can really offer this type of services without spending everything you have in your bank account or, for your retirement, that, that is key, right? Because otherwise people would not do it.
yeah, I mean, we are 97% cheaper than the medicine you would take. So if we were the first line for, fresh after a diagnosis or early stage dementia, the government is saving 97% of their costs.
Yeah,
And because it's telehealth, because it's online, it's readily available. So
that's amazing.
um,
That's
we have a
amazing.
lot of work to do.
You do. I mean, beyond dementia, there are lots, I'm sure, lots of other cognitive or neurological conditions that you could eventually address, right?
100%. I mean,
Yeah.
we are in the memory business. Dementia is just one of the biggest
Yeah.
obstacles that we must overcome. But our business is the memory business. So,
Yeah.
there's a lot of R&D and there's a lot of exciting products that we are envisioning down the line that surround is all around memory and memory preservation. So we're very excited about it.
Yeah, for sure. So, what are when right now? I mean, I have a few questions. What do you need the most? How can people help you? And also, what are the biggest barriers, whether it's technological, regulatory, reimbursement, user adoption that you're facing in the health tech innovation area and with companies like yours?
Yeah, I mean, I think we are fundraising. I think we've got quite a lot of interest already ahead of our round. So, if people want to be on this mission, just let me know. My email is on the platform. It's Tony@solimhealth.com. In terms of other obstacles, I think building trust is a massive thing, and it does take time,
Yeah,
especially when it comes to the clinical services. Um, I think regulations is on our side because regulations around what we're doing is more lax. Obviously, it means that we have to, be grateful for the regulation being so positively on our side, and obviously, use it to in a positive way. I think the biggest thing that we are super interested in is hiring you know, very talented engineers on the
mm,
tech front and hiring real human beings on the, you know, health service delivery aspect of things. You are going to hear, people's stories. It's a privilege to really do that. And, we are going to be very diligent on the people we bring in. Especially at the beginning, to make sure that they are people who understand dementia. If a
yeah,
patient is struggling, they know how to take their time with that patient and that loved one to really, you're building memories. This isn't a robotic process. If you want the robotic process, you can speak to our automated tool and build it there. Even that, the questions are still very empathetic. So attracting talent is going to be a big one. Um, and then, scaling with purpose. So, you know, obviously the suits are gonna, be part of the journey at some point, but making sure the suits are not, you know, you know, turning this into a stiff, cold business. And that's gonna be a big fight that I'm gonna maintain along the way, true and true, because this is too important to just let um let be derailed by corporate greed.
for sure. Well, it looks like you have the right I think it's the right positioning, but I think the right understanding of the business world and also what, most importantly, what people need and are looking for. And I think bringing real people as a support, as customer service teams, is so important. That in itself is going to be very attractive because people are so used now to talking to AI robots, you know, and if with something like what you offer, you have to have humans really, yeah, humans, not humanoids, take care of that and support your vision and your mission.
Yeah, I mean, the name Solim comes from the fact that we believe that, the soul is really in the memory of people. So the reason you are Catherine and I'm Tony is because the memories that make you who you are and the memories that other people have of you. So if we replace that with a cold interface,
Yeah.
sort of defeats the point, isn't it?
Yeah, no, for sure. All right. Well, this is wonderful. I really appreciate everything that you presented today. So, one last question I'd like to ask you, because you are an entrepreneur, you've done that before. So, what advice would you give to other medical professionals or engineers who are considering launching a health tech venture?
Um, I think I'll give advice of just launching a venture in general. I think getting started is better than, knowing exactly what it is you want to build. Just get started. And even better than that is having a real problem that you want to solve.
Mm.
Ideas are overrated. The most valuable place in the world is the graveyard because there's tons of ideas there.
That's so
Ideas are
true.
overrated.
So
So
true.
find a problem that you are willing to spend 5, 10, 15 years solving, and then the solutions will be you'll quickly see the solution that you need to bring to the market, and that's really what you need to focus on. Focus on the problem. What is the problem you want to solve? Because you might end up changing how you're going to solve that problem, which is fine. That's called pivoting. But as long as you have the core problem that you want to focus on, that is the main thing. And that goes for doctors, that goes for engineers. Find a problem worth solving and just, tunnel vision.
Yeah, so true. I mean, this is what I think is the first questions that investors are asking anyway. What problem are you solving? Right? So
Yes.
you're right. You have to have a problem, but you have to get going and not wait for something that you see as perfect. Because I see a lot of people say, "I'm not ready. This is not perfect. This is not good enough." I mean, if you get the ball rolling, you have a chance to improve everything you do, and you're going to get feedback, and you're going to make some errors, and you're going to learn so much along the way. But I really believe you're right. You have to get the ball rolling, do it, know what problem you solve, and just do it. Like Nike says, just do it,
Just
right?
do it. Just do it. You're 100% right. It's not about the destination, it's about the journey.
Yeah,
That's where all the learnings come from. So
yeah,
if you're striving for perfect in a siloed room in your basement, trying to build a perfect product, you might spend months on it and then find out nobody wants it. So build
okay,
something, just get started,
yeah,
find some inspired people to work with.
yeah.
And
Very
yeah,
true. You have to have the right team around you. You have to have people who believe and who are in for the mission, for the long-term mission, because it is also a long-term mission, and never give up.
yeah. But you have to believe yourself if you're going to convince other people to believe.
Yeah,
So you have to
yeah.
be completely all in.
You do. All right. So if someone is interested in using your services, the best way is to contact you directly. I mean, or what is it if it's not that?
I mean, our website is live, so you
Okay.
can simply register, you can sign up for a session. We are going to be launching the ability to actually just rebuild your memories in a few. I don't want to put pressure on my engineer. I'll say a few months just to be safe, but
Yeah.
likely before the end of the year or at least the beginning of next year.
Okay, well, wonderful. Well, thank you again for doing what you are doing, for launching these amazing initiatives that will change the lives of millions of people. And it's beautiful you did it, and amazing. Congrats.
Yeah, it's a long road ahead, so
It
just getting
is.
started. We just got started, so let's, instead of waiting for things to be perfect, just get started, you know?
Yeah, and this is why I interview people like you, because then your story is shared and people learn about what you do, and they can talk to you if they want to work with you, to work towards your
Yeah.
goals. And that's the one of the reasons I do that is I want to give you some more exposure, because as a startup you need exposure, and sometimes it's just one person that can share your story and what you do with someone else who can become a critical partner in your journey. You just never know.
Yeah, I mean, the ripple effect is highly underappreciated. It is such a powerful thing.
It
So
is.
I do appreciate you for having me on, Catherine.
Well, thank you so much. I really appreciate again your time here, Dr. Tony. I just love to call you Dr. Tony. That's just how I see it.
It rings really well. It flows out very well.
You stay
I,
Dr. Tony with me. That's
I
right.
I do like the sound of it. It just makes me miss the clinical setting a little bit.
That's why you're a
Um,
doctor. You'll be a doctor all your life now. So, I think it's important to remember that. I think also that gives you some weight and some power, and that will help also generate more trust, I think.
yeah, I mean it's working so far.
Yeah,
We just have to, yeah, keep going. I'm very excited for what we're building and
yeah.
some of the R&D products we have coming up. It's super exciting.
Yeah, it
I
is.
mean,
It is.
I'll start blushing if I start thinking about it. So it's super exciting.
That's great. Well, again, thank you, everyone. Thank you so much for watching. I hope you enjoyed. I'm sure, I not hope, I'm sure you enjoyed this conversation. And I'm sure you are here to share this information everywhere as possible, as much as possible, because I can share on my networks, but if you do the same, it's going to give Tony and Solim Health a lot more exposure, which is what he needs right now. So I really rely on you to do that. That would be wonderful. And remember to subscribe to my channel. It helps continue doing what I'm doing. I don't charge for anything. And if you know anyone who is an innovator, who is interested in having a podcast recording like this one, share my information with them, and I will be able to talk with them and have a discovery call and determining whether it's a good fit or not. Again, thank you, and I will see you next time.